The effects on socialization due to COVID-19 by Caitlin Myatt, 2004-22019. What is COVID-19? COVID-19 is a new strain of virus that has not been previously identified in humans. In some cases, illness caused by novel coronavirus can be mild. In more severe cases, the novel coronavirus can cause pneumonia, acute respiratory distress syndrome, severe influenza-like illness, kidney failure, and even death. Grey Bruce Public Health 2020. March 2020, Canada joined the many countries in the attempt to control the COVID-19 virus by shutting the economy down and placing a stay-at-home order for non-essential work or shopping. The COVID-19 guidelines changed many of the ways society interacts in public. Frequent hand washing, sanitizing, face shields, masks, and a social distance of 6 feet became the new normal. As stated by Sociology in our times, socialization is a lifelong process of social interaction through which individuals acquire a self-identity and the physical, mental, and social skills needed for survival in society. Sociology in Our Times, 5th Canadian edition. The text also states that socialization is essential for the individual's survival and for human development, and members of a society must be socialized to support and maintain the existing social structure. Sociology in Our Times, 5th Canadian edition. Due to the pandemic, people are prevented from socializing, which has been stated to be a fundamental human necessity. Impact on the new normal. When the pandemic became a reality, many flocked to any store to buy toilet paper, sanitizer, food, or hygienic supplies. NCBI stated that some individuals bought much more than they necessitized, therefore showing a complete disregard for the needs of others. National Center for Biotechnology Information. News networks and daily COVID-19 updates from our Prime Minister, Justin Trudeau, filled our televisions and radios during the days of quarantine, which began March 2020 and decreased more and more as the summer months went by. The information being portrayed to Canadian society created fear for many individuals, involving even the people closest to them, such as their neighbors. NBCI stated that, while diseases such as COVID-19 spread easily by human contact, it is important to be mindful that the enemy remains the virus and not our peers. In fact, the efficiency of our response and our social experience depends on how close we remain to each other and how much care we display. National Center for Biotechnology Information. Although fear of contracting the virus and or spreading it was and continues to be a concern for individuals in Canada, many found ways to spread love and kindness without physical touch or sharing the same space. Gift baskets and drive-by birthday parties were just a few of the ways people connected with one another. NBCI explained that socializing is a fundamental human need, and a long duration of isolation from others outside the family unit leaves individuals struggling with their mental health. National Center for Biotechnology Information. American Psychological Association expressed that physical isolation combined with economic instability, fear of infection, and stress surrounding the uncertainty of the future has had a profound impact on global mental health. American Psychological Association 2020. What does the future hold for Canadian society? As discussed, the mental health of many Canadians was and continues to be negatively affected by the social restrictions and new social norms, such as masks, social distancing, routine sanitizing, and limited gathering. Although average citizens cannot contribute to creating a vaccine for the virus, as a society, we have the power and tools to positively affect the mental health of others. NBCI states that the emotional support that we can collectively give is vital to their well-being, and it can limit the negative effects that social isolation can have on their mental health. National Center for Biotechnology Information. Currently, the only evidence of a resolution to the pandemic is a vaccine for COVID-19. Although it is uncertain when the vaccine will be administered to all Canadians and life will resemble what we once knew as normal, we do, however, have previous viruses and their accompanying vaccines to compare. With this comparison, it gives evidence that there will be an end to the COVID-19 pandemic. Even after the vaccine, NBCI states that the physiological effect could potentially remain in our communities even long after the pandemic. National Center for Biotechnology Information. Society may have to relearn what it meant to live a normal life, and some may fear COVID-19 even when it is no longer a threat. Regarding the younger age group, American Psychological Association stated that during the initial COVID-19 crisis, adolescents' social and academic lives were almost exclusively viral, likely leading to a marked increase in screen time and social media use. American Psychological Association 2020. Elementary to college and university has been recreated to serve their students remotely. This innovation of how education is taught may continue and develop once the virus is no longer a threat. Conclusion. COVID-19 is something that has affected all parts of the world, and a unique time no one has quite seen like it before. NBCI states that there is a risk of increasing social rejection, growing impersonality and individualism, and the loss of sense of community. National Center for Biotechnology Information. However, as stated previously, it has pushed society to think more about others and alternate ways to show kindness and love than before. The world has seen many viruses before, but COVID-19 is a unique challenge that is unpredictable to state the outcome. For now, society has their hopes on a vaccine that may bring a sense of normal back into the world. References not including the pictures include Sociology in Our Times, The Essentials, 5th Canadian edition by Murray, Linden, and Kendall, National Center for Biotechnology Information by Kevin Cicali, 2020, Elise Damas Forbes, 2020, American Psychological Association, Physically Isolated but Socially Connected, Psychological Adjustment and Stress Among Adolescents During the Initial COVID-19 Crisis, and Grey Bruce Public Health 2020. My sources were helpful because they explained in detail what COVID-19 is, what has happened as a result, and implications for the future.